Good morning.
Good morning.
Is there anyone who can remember anything about what we spoke about last week? What were we?
Spinal fusion.
Without reading. What was it?
Spinal fusion.
Spinal fusion. That's what you remember.
It's my husband.
Without referring to notes, let's see what has stayed with you. Yeah.
That the mind and the body are fused. And in every cell is mind and spirit.
Yes.
So I was focused before more on the separation and
Yes.
connection rather than
Yes. Is this meaningful to you?
very.
Yes. Good. That the mind and the body are not fused.
They are not?
No.
Yeah, that's saying.
They are the same.
Oh, I better watch what I
When we say that they are fused, what are we saying?
There were two.
That they're the same.
They are two. See, we must be very precise. Yes.
We also spoke about physical symptoms being a manifestation of a person's being in the world and not purely just of emotions.
Very good. Very good. That's very important. Anything else? Well, I think that you have pointed out the two salient issues which were brought out last week. Mind and body are one. There is no separation. And the metapsychiatric approach to psychosomatic medicine is the treatment of modes of being in the world. What is a mode of being in the world?
It is the way a person views the world, his perceptions of the world, and the way he lives them.
And his value system, which he has assimilated in the course of growing up. In what way is a mode of being in the world different from adjustment, adaptation, and lifestyle? What is adjustment?
Those are all operational functions.
Right. Wonderful. What do we mean by operational functions?
Something that can be done.
Right, exactly. They are ego functions. Adjustment can be done. We can do it. Adaptation, we do it. A lifestyle is chosen. What is the difference between adjustment and adaptation?
Potential and actual.
Potential and actual? No. They are very similar, except adjustment is on a narrower scale. We can get adjusted to the Westchester Institute of Counseling and Psychotherapy. Adaptation is usually we think of it on a broader scale, like adaptation to a culture or to a political situation. It is something that we consciously pursue and volitionally accomplish. But modes of being in the world are not done. They are expressions of our basic assumptions, our value systems, our cultural educational backgrounds, and the way we perceive life. So, how can we understand people's modes of being in the world? A lifestyle is easily understood, right? Or adjustments are they are self-evident, so to speak. But how can you suppose a patient or a client comes to us seeking help? How can we tell what his mode of being in the world is?
I think we can see it, even though it is not a conscious thing. The way he acts on or responds to life is a manifestation of his mode of being.
Yes, that's right. You're very close. Actually, yes, did you want to say something?
Is it the way people deal with time, space?
How do we deal with time and space? Could you elaborate what you mean?
No.
No. I
That's why I asked you the
noticed that. Yes. Actually, there is a method of understanding modes of being in the world. This method is called phenomenological analysis. What do we mean by phenomenological analysis?
Analyzing what somebody does.
Analyzing what somebody does. Could you explain?
Analyzing phenomena. The things that a
Analyzing
person does.
phenomena are things which a person does. That would be operational analysis. No? Yes? Washington?
Analyzing their reality. The way, what things to be. That was all different percent.
Yes, the way he appears in the interview. And what else? Analyzing his feelings? No. Yes?
By properly questioning how he views things.
Well, it could be part of it, yes.
Analyzing what he
Analyzing what is. What is?
what seems to be.
Well,
What is the meaning of what seems to be?
before we can understand the method of phenomenological analysis, we have to understand that everything that is happening to us in life has a meaning. What is a meaning? Meaning is not an interpretation. What are meanings? No.
A reason?
Reasons are not meanings.
Relating to something outside of ourselves.
Good.
Lying.
Meaning the value.
Meaning is a meaning and a value is a value. What is a value? We mentioned it last week. What is value? Huh? Say-
That which we cherish.
Yes, whatever we value, that's a value. Now, what is a meaning?
What we attach meaning to?
Well, meaning is the mental equivalent of a phenomenon. What is a phenomenon?
Yeah.
What?
Yeah.
Appearances, right. Whatever appears to be is a phenomenon. And the mental equivalent of that appearance is a meaning. Suppose somebody has a severe headache. That is a phenomenon. The patient appears to have a headache. You can see it, that he has a headache. And he can tell you that he has a headache. Now, ordinarily, we would jump and say, why does he have a headache? Right? We would immediately try to find the cause of his headache. That is common sense. It's a natural way to psychotherapeutize, to find out the cause or the reason. Unfortunately, he that seeks reasons only finds excuses. So we are not interested in the causes of phenomena. We are interested in the meaning of phenomena. We are interested to discern the mental equivalent of that particular, whatever phenomenon we are confronted with. Now, a mental phenomenon is always a thought. A meaning is always a thought which underlies a particular phenomenon. We said that the mind and the body are one. Right? That the mind doesn't cause a physical symptom. Neither does anything else cause a physical symptom. But a thought can take on the form of a physical symptom. For instance, a frustrating thought, a thought of frustration, anger, can appear as a headache. You see, if the mind and the body are one, then the mind cannot cause a headache. But a thought can take on the appearance of a headache. Is this clear? So in psychosomatic medicine, we are not looking for causes, for reasons, and for effects. Cause and effect reasoning is transcended.
This reminds me of the Gestalt approach. In other words, the therapist would say to the guy, let the headache speak for you. What is it saying?
Yes, that's right, that's correct. Yes, but we seek to discern, together with the patient, the meaning of phenomena. And this is called phenomenological analysis. Is this clear? I can see on your face that you suddenly saw the light. This is a phenomenon. When the mind is illuminated, the face lights up. You see? Now, every time we are faced with a phenomenon, we seek to discern the meaning of that phenomenon. And slowly, through understanding the meanings of a patient's various reactions, we can discern his mode of being in the world. Because our mode of being in the world is a phenomenon. And it reveals to us our basic assumptions, values, and perceptions about reality. For instance, the lady which we mentioned last week, with a severe spinal condition, had an eminently willful mode of being in the world, which revealed itself in the interview as a semantic problem. What is a semantic problem?
Problem with
A
words.
problem with words.
Expression.
Right. She was a victim of a habit of should thinking. It is amazing what words can do to us. The language which we acquire can greatly color our perception of reality. Not only do we judge reality through our eyes and ears, senses, but also through the language because language is a way of thinking, and our habits of thinking interpret reality. Now, what is the difference between an interpretation and a phenomenological discernment? You brought this up, you answer it.
Phenomenological discernment is seeing what really is, rather than interpreting it through our own perception.
No, not quite. Sorry. When we discern a meaning, we are not seeing what really is. We are seeing of what the patient thinks that really is. And when we are interpreting something, we are not stating what really is. We are stating of what Freud, Jung, Adler, Sullivan thought about what really is. Is that clear? An interpretation is an imposition of a meaning in the context of certain theoretical system. So, the patient doesn't tell us what really is, and neither do we, unless we really know what really is. And that ain't chicken feed. You see, our difficulties are that we are not even trying to develop the capacity to cognize what really is. What we are learning is to know what Freud thought about what is, or somebody else. Yeah?
What about what Hora thought about what really is?
That would be a mistake.
I mean, isn't it possible to get into the same problem with?
Well, I wouldn't let you. Because we are not talking about Hora's system, we are talking about phenomenological analysis. Phenomenological analysis is the clarification of what seems to be. You see, after we have learned to understand all the various things which seem to be, then we begin to approach the cognitive faculty of discerning what really is. Because this isn't, and that isn't, and that isn't, and that isn't, and through a via negativa, we become experts in what isn't. And after you have become expert on what isn't, you may begin to see a little bit of what is. But anyway, what we have to, in order to help people to be liberated from their somatic sufferings and problems, we have to be able to discern the mental equivalent of these problems, share it with the patient, clarify it to him, and thus altering his perceptions, his values, and his responses to the various aspects of life. Suppose somebody has a severe headache and we discover that he is seriously frustrated because he didn't get a promotion or he didn't get the recognition he would have liked to. And now he has this headache. So we helped him to see the connection between his frustrating thoughts about the recognition which he craved and his headache, and his resentful thoughts about his boss or somebody. So what happens then?
He just smile at you.
What?
We just smile at you.
He gets mad at you. Well, that can happen and something else can happen, but what? Under favorable circumstances, two things can happen. Either the headache will get worse. If he's a self-righteous man, his headache will get worse. I'm justified to be mad at him. I'm justified. But if he has just a trace of humility, what will happen then? He will get embarrassed. And his headache will turn into an embarrassment. And that's a very good sign. Because when we get embarrassed, we recognize that the problem is based on vanity. And we are willing to let go of it. And then not only the headache is healed, but his particular intention, ambition, desire comes into view and it becomes subject to intelligent scrutiny. And then this patient may say, well, it is really foolish of me to inflict this suffering upon myself through such desires for recognition. And he may be willing to try to find something that is more valid in life than personal recognition. Now I ask you, what in the world could be more valid in life than seeking recognition? Isn't that normal? Of course it is. But normal is sick. You see that? Now, if normal is sick, is abnormal healthy?
Two wrongs don't make a right.
Right. Normal is sick, but abnormal is also sick. Now the question is, what is healthy? Clark, what is healthy?
Be healthy is to be beneficial.
Right. Could you explain to us what we mean by that?
Well, it has to do with understanding the truth about human existence and living in accordance with it.
Yes. So where can we find this understanding of the truth about human existence?
Well, it's self-validating.
How does it validate itself?
When one lives in accordance with the truth, it produces the fruits of peace and joy.
Yes, very good. Is this clear to everybody?
And physical well-being.
Of course. Since the physical is mental, right? Then, when we have learned the existentially valid mode of being in the world, then we are healed of our problems and protected from running into new and new problems all the time. Because our mode of being in the world is in harmony with the fundamental order of existence. Who is to say what is the fundamental order of existence? Who is this authority? It is not Freud, it's not Jung, it's not Adler, it's not Sullivan, it's not Hora. Who is it? Hmm? Love intelligence. Who is he?
Why?
Yes. The right understanding of God as ultimate reality and the universal principle of life can help us find the existentially valid mode of being in the world. Now, do not misunderstand that we are talking about religion. When we mention God, we are not talking about religion. We are talking about the true nature of reality, which needs to be discovered and understood in order to be sane and to live in harmony with the fundamental order of existence. Religiosity can help, but not necessarily so. What is required is understanding. And understanding is not easily attained. But through consistent phenomenological analysis of our problems, we can gradually come closer and closer to a realization of what is compatible with healthy living and what is not. In yesterday's case presentation, it became clear to us that willfulness and should thinking are not compatible with healthy living. It's just one of the many ways that we can screw up our lives. But certainly this lady has learned a very important lesson, that you cannot be willful and insisting on having your way without hurting yourself. And the gentleman with his headache over the frustration of not getting recognition may also discover that personal vanity or ambition is also not compatible with healthy living. And there are many other ways which we can hurt ourselves in life. We have certain mental inclinations which result in psychosomatic disturbances. We say in Metapsychiatry that problems are lessons designed for our edification. Does everyone understand this principle? Problems are lessons designed for our edification. What does it say?
I like that in contrast to problems are something to be solved, which is
Very good.
to be gotten rid of rather than to be learned from.
Right, exactly. You see, when we have a headache, if we are not sophisticated in a metapsychiatric way, our first impulse is to quickly get an anesthesia, quick relief. And we get quick relief but we haven't really understood anything. We haven't learned anything about how to live more intelligently. But if we understand the principle that problems are lessons designed for our edification, then we shall not be afraid of our problems. We shall not resent having problems. We may even reach a point that we welcome problems without being masochistic about it, right?
I wanted you to clarify something for me. When you say psychosomatics,
Yes.
okay, normally I tend to think it's something that our mind causes this.
Yes.
Or is there any distinction in existential terms between physical symptoms for which doctors can find no bodily cause and physical symptoms for which there is a cause, such as cancer or something like that? Does it matter in existential terms whether doctors find a physical reason, quote, physical reason, or not? Or is it still saying the same thing?
Now, if it is true that the mind and the body are one, then in principle all physical problems are mental problems, no matter what the diagnosis is. However, there are grave conditions where the meaning is so obscure or the patient's involvement in the problem is so deep that there is no way of approaching it through a phenomenological analysis. And when we cannot approach a problem with phenomenological analysis, then there is nothing else left but resorting to traditional ways of alleviating the suffering. But you know that they are most unsatisfactory anyway. And we can look forward to a time where all problems will be understood clearly as opportunities to gain a clearer understanding of existence and come into greater harmony with it. Therefore, it is indeed a great privilege for all of us to sort of get in on the ground floor and learn to subject every one of our problems to phenomenological analysis and try to understand the hidden lesson which is tailor-made to our particular needs at one particular time. And the more we learn to do this, the greater our protection will be from developing some conditions which are beyond our capacity to resolve through this process. Because the more we learn, the quicker we learn to live in harmony with a fundamental order of existence, the more protection we have from the common sufferings which befall the vast majority of people. So not only that we are in a very blessed profession where we can be of great benefit to our patients, But we ourselves are greatly blessed by the increasing knowledge of what the problems mean and what are the ways of their resolution. Yeah? Any more questions?
Something like appendicitis, some of the more obvious physical
Yes,
situations.
if it's an alarming situation, being immediately threatening life, there is no time for analyzing
Right.
anything, and such an intervention is indicated.
But I mean, do you see the development of something like appendicitis as
Oh yes,
coming from
oh
the
yes,
last one?
everything has a meaning. We may not be able to discern all meanings, and if somebody may help us to discern, we may not be ready to face those meanings. And then, of course, we are in trouble. But if a meaning is discerned, and if there is the humility to face up to those meanings, the problems can disappear through those realizations. And that is marvelous.
And everybody who has an operation, I mean, when you take the appendix out, ideally, that person then should really be they hadn't before.
Beg your pardon?
Taking the appendix out could only be the beginning when that person really, if they wanted to, finding out.
Yes, of course. You know, it so frequently happens that once you have one operation, you will have a second one soon after, or a third one. There's something, you see, what happens is that the problem is not solved. No matter how successful the intervention, the physical intervention is, the problem is alleviated, but it is not solved. It is not solved until you have understood and you have learned the lesson which that problem came to teach you. It's no use that no matter how many successful operations we have, we still have to learn that lesson. So the sooner we learn, the better, right?
A bacterial infection is the same situation.
Yes. Yes, we know very well, and in medicine, that there is no direct relationship between bacterial or viral infection and the appearance of the disease. There's an intermediate step, which is called receptivity. And that is a mystery. Wherein lies the receptivity? If you travel in the subway or in a crowded place, there are tuberculosis bacteria, there are viruses swarming all over the place, but not everybody gets sick, right? Some people get sick, some people don't get sick. Now we speak in medicine about immunology and such things. Well, what is it, really? What is it that makes some people susceptible to viral invasion, and what is it that makes some people not susceptible? And it is most probably this mental factor which underlies, and it is part of our mode of being in the world. So much for today, all right?